Hello everyone! So today we will be discussing healthcare and whether or not it's just a privilege. So for several years, I worked for CVS Pharmacy as a certified pharmacy technician. I spent my days counting pills, dealing with insurance issues, and just helping out my patients the best that I could. While I have a lot of fond memories of those days, what overshadows the fun I had with my coworkers was heartbreak and desperation that I saw on a daily basis. There was one patient in particular that I will never forget. So I was working the drop-off counter one evening when an elderly lady came up to my window. At first, she just wanted me to refill her prescription. She was a diabetic patient and picking up her insulin. The cashier informed her that her total was over $300. She felt a mistake had to have been made. We must have incorrectly run her insurance. But that wasn't the case. Her deductible had reset, and her Medicare was no longer paying as much as they had before for the cost of their medication. She was responsible for a copay over $300. As I was trying to explain what all of this meant, she started sobbing. Insulin is not a medication to mess with. You can't just not take it. Her blood pressure would rise to dangerously high levels, and it could be fatal. There was nothing I could do to help this woman as she cried and explained that she did not have the money to afford her medication. She left that day without her insulin. This is just one example of our broken healthcare system. Healthcare is a basic human right, not a privilege. It is our moral responsibility to recognize this and use our voices. We are the future. We are voters. We are future educators and politicians. We are in the most important position to push for a reform. To put forth and vote for policies where healthcare is not a privilege dependent on income, insurance, citizenship. So let's talk about it. Why is this a problem? Well, to answer this question, I think it's important to first look at the facts. According to a research report published last year by RAND Healthcare, the average cost of insulin is exponentially more expensive in the United States than other countries. In Japan, the average cost is $14.40. In Germany, it was $11. In Australia, it was $6.94. Now, when you take into account that the Yale School of Medicine reported the average cost to produce a vial of insulin is generally between $2 and $4, this makes sense. So how much is it here? $98.70. An article published in the National Library of Medicine reported the results of a study that they did on insulin-dependent individuals. So they found that 20.4% of these people said that they had rationed their insulin because of cost. And of these people, 71% of them were younger than 65. We'll come back to why this is important in a little bit. We've spent a good bit of time now talking about insulin, but what about other medications? Does this problem start and end with insulin? Absolutely not. So according to an KFF poll, 6 in 10 adults reported being on at least one medication. 3 in 10 reported that they don't take their medication as prescribed due to cost. And 1 in 5 reported not filling their prescription at all because of costs. These include many life-saving medications. Our country's failure of a healthcare system is why so many people are suffering. What is especially sad is that the United States is the only first world country without universal health care. It's been reported that 20% of the non-elderly population is without health insurance at any given time. The U.S. Department of Health and Human Services stated that uninsured adults are less likely to receive preventative care. Children without healthcare insurance are less likely to receive appropriate medications for conditions such as asthma or critical protective services. These include dental care, immunizations, regular wellness visits. So now what? Are we a lost cause? What can we do? Well, universal healthcare already exists. Remember the insulin prices we went over a little while ago? Every one of those countries that had cheaper insulin than us have universal healthcare. We can have that too. We just have to be willing to put in the work to make a change. We have seen that policy change works. As we heard about earlier, of the insulin-dependent individuals who reported rationing their insulin, the vast majority of them were under 65 years old. Well, in 2022, the Biden administration pushed through the Inflation Reduction Act. This capped the out-of-pocket costs of insulin to $35 a month for Medicare beneficiaries. In most circumstances, the people that have Medicare are older than 65 years old. So it makes sense why most of the people who ration their insulin were not helped by this law. Most of those who were helped and their insulin costs were capped didn't have to ration their medicine. Policy change works. And what if we don't do anything? What will the future of the United States of America look like if we do not act? We can expect to see more people dying because they can't afford their medication. They won't be taking their meds like they're supposed to, so more people will end up in the ER. Well, emergency room visits cost thousands, so more people will have long-term medical debt. The healthcare system will just continue to get more and more expensive, and healthcare inequality will only worsen. It's our turn to take action, whatever that means for you and what you are personally able to do. Whether that means voting for candidates who support affordable healthcare, supporting the actual legislation, signing petitions, or just having conversations. Engage in conversation and change some minds. Changing even one mind is one more vote, one more signature, one more mind to change minds. I always think back to the lady crying at my drop-off window. She wasn't asking for a luxury. She wasn't asking for the impossible. She was asking for the medication she needs to live. She was asking for the right to stay alive. We cannot claim to be the greatest country in the world and put ourselves on a pedestal when we have people dying because they can't afford a drug that costs less than a Big Mac to manufacture. If you take only one thing away from today, remember this. There are candidates that care for the genuine well-being of their people, and then there are those who care for themselves and lining their own pockets. It's up to you to decide which candidate you want running our country. Thank you.